Every labor and delivery unit has an OB emergency cart, and this is basically everything that you're going to use in the case of an emergency. This is a weight scale so that we can measure blood loss very, very quickly, and this cart is usually on every unit with a zip tie locking it shut. That way no one takes anything out of it and you have absolutely everything that you could possibly need in the event of an emergency. You're not like searching for things. So you have your medications, your IV and blood draw kits, tubing, fluids, urinary catheters, sutures, different instruments, gloves, and just different miscellaneous supplies. Usually the medications that we give to stop bleeding very, very quickly are sealed up and the pharmacy fills them. But some examples of exactly what's in there is neuroprotection drugs like magnesium and reversal like calcium gluconate. You have your blood pressure meds like your hydralazine, your labetalol, and then your bleeding meds like your oxytocin and your TXA. You also have your terbutaline to stop contractions. This is an example of what some of the drugs look like, and pharmacy is usually going to make sure that nothing is expired and that it's all ready to go so that you can just grab it and use it immediately. This is all the IV stuff to start an IV, as well as different tubing if you need to send labs and things like that. But you have tourniquets, you have blood tubes, you have essentially everything that you would need in order to not have to be searching for anything and just start a second IV very, very quickly, because that's the first thing that needs to be done. Is you need 2 IVs, both 18 gauge, because that is how you're going to be able to transfuse blood products very, very quickly. There's even like full IV starter kits in here so that you don't have to think about anything. Everything is just right there ready to go, which is really important because things can happen very, very, very quickly. Here you have all of your primary tubing, your secondary tubing, your Volutrols, your normal saline, and usually in labor and delivery we use lactated ringers, but in the case of an emergency, a lot of the times you will need normal saline. This is your drawer with devices to stop bleeding in the case that the uterus will not clamp down and will not stop bleeding, and you have to insert a device in order to actually force the uterus to stop that bleeding. At my facility we use a Jada. In the next drawer, you're going to find your instruments and every kind of suture possible that the doctor might need to make a repair very, very fast. You're also going to have tools like your forceps and things like that. Forceps are inserted through the vaginal canal and they're used for an emergency vaginal delivery. You have your sterile laceration tray in case of bleeding and like cervical lacerations. Most often when we're opening this cart, it's because we're looking for a certain kind of forceps that the doctor wants. Then in this drawer, you have your gloves, you have your betadine. There are extra drapes in here, just tons and tons of sterile gloves. You have your Surgicel, which is used as an extra measure to stop bleeding. Basically, everything in this cart is labeled and it has everything in it that you could possibly need in the event of any type of like labor and delivery or OB emergency, just to be able to get to these things very, very, very quickly. Because the last thing you want to do in an emergency is be running all around and the doctor needs you right there with them in the room and you're out trying to find supplies. It's just not good. You don't want to be doing that. If we have any type of high-risk delivery, the purple cart is always outside of the delivery room.